ChatGerry, the missing layer in modern medical education. Number 1515, VPT 071, January 26, 2026. Gerald C. EclaireMD Foundation. Category: Medical Education. Introduction. Modern medical education is one of humanity's great achievements. Doctors today understand anatomy with astonishing detail. Biochemistry and molecular biology explain processes that were unimaginable just decades ago. Pharmacology has produced drugs that save lives every day when used correctly. Clinical training emphasizes pattern recognition, diagnostic logic, evidence-based guidelines, imaging, and laboratory precision. Surgery, interventional medicine, and emergency care have advanced dramatically. And yet, something important is still missing. This gap is not caused by a lack of biological knowledge or chemical understanding. It exists because modern medical education is built mainly around snapshots rather than motion, averages rather than trajectories, and categories rather than continuous change. Medicine excels at describing what is happening at a given moment, but it struggles to explain how disease evolves over time inside a single human body. Most diseases that eventually kill us do not appear suddenly. They grow quietly. Damage accumulates slowly. Reserve is lost gradually. Then, one day, a stroke, heart attack, kidney failure, or cognitive collapse occurs. To the patient, and often to the physician, the event feels sudden. In reality, it is the final stage of a long physical process. I often think of medicine as a large structure supported by 4 foundational columns. Traditionally, science rests on mathematics, physics, chemistry, and biology. When all 4 are present, the structure is stable and resilient. When one or more are missing, the structure may still stand, but it becomes fragile. Today, most of modern medicine is supported mainly by only 2 columns. Biology and chemistry. A building does not fail because gravity suddenly changes. It fails because sideways forces accumulate, wind, vibration, and even loads, and fatigue slowly weaken its structure. For years it may look fine, then one unexpected stress pushes it past its limit. This is exactly what we see in chronic disease. Modern medicine stands firmly on biology and chemistry. These pillars are strong enough for diagnosis, treatment, and acute care. But when disease involves long-term stress, damage accumulation, nonlinear progression, or sudden collapse, the absence of mathematical and physical thinking becomes obvious. The system does not fail because biology is wrong. It fails because the structure foundation is incomplete. That missing layer is mathematics and physics. Why statistics alone is not enough. Most quantitative training in medicine today is statistical. Statistics is valuable for population studies, clinical trials, and public health. But statistics is not designed to explain how disease progresses in one individual body over time. Statistics describes groups. Disease happens to individual patients. A stroke does not occur because a person crossed a statistical threshold. Kidney failure does not happen because an average was exceeded. 7. Dementia does not begin because a chart says so. These events occur because damage has accumulated quietly until the system can no longer compensate. Statistical models smooth out extremes. But in medicine, the extremes are often where death occurs. Outliers are not noise, they are warnings. They signal imminent danger. To understand disease progression, we need tools that handle time, accumulation, memory, fatigue, and delayed failure. This requires a different mindset than statistics alone can provide. Mathematics, but trajectory-based medicine and mathematics, when taught correctly, is not abstract or intimidating. It is a language for change. The foundation should begin with calculus. Calculus teaches how things change over time. Without it, time is vague. With it, time becomes measurable. Physicians can begin to understand rates of deterioration, acceleration of risk, and the difference between slow drift and rapid collapse. Linear algebra follows naturally. The body is never driven by one factor. Glucose, blood pressure, lipids, sleep, stress, activity, inflammation, and diet interact continuously. Linear algebra teaches how multiple factors combine, reinforce, or cancel each other. It trains physicians to think in systems rather than isolated numbers. Set theory helps clarify diagnostic thinking. Many diseases do not fit clean categories. Borders are fuzzy. Conditions overlap. Learning how sets work helps physicians understand why rigid cutoffs often fail in real life. More advanced tools deepen insight. Partial differential equations describe processes that change across both time and space, such as blood flow, oxygen diffusion, inflammation, and glucose transport. They explain why local problems become global failures. Complex variable thinking introduces oscillation and feedback. Many physiological systems oscillate. Blood pressure, glucose, hormones, sleep, and stress all move in cycles. Feedback can stabilize a system or destabilize it. Understanding this helps explain why the same intervention works in one patient and fails in another. Topology, which studies shape and connectivity rather than exact numbers, is especially powerful. Disease progression often follows recognizable patterns even when values differ. Topology helps identify failure pathways before collapse occurs. In my own research, I have applied topology not only to medical imaging, but to disease behavior itself based on pathophysiology. Physics and engineering, the language of damage. Mathematics describes change. Physics explains damage. The human body is a physical structure. It bears load, resists pressure, and channels flow. From birth to death, it is subjected to solid mechanical stress, such as heart attacks and strokes. Fluid flow stress from metabolic disorder progression. And overall physiological stress across the lifespan. Elastic behavior is reversible, while plastic behavior is permanent. This distinction maps directly to early versus late disease. Early metabolic stress may be reversible, but late structural damage often is not. Some organ and tissue damage may repair itself, but damage at the cellular level is usually irreversible. My own stroke illustrates this clearly. Years of diabetes caused microvascular calcification in the brain, a largely irreversible process. An acute blood pressure spike then triggered vessel rupture near the brainstem. Without a physical damage framework, this sequence is difficult to understand. Dynamics explains why systems fail suddenly after long stability. A patient can appear stable while damage accumulates silently. This is common in vascular disease, kidney disease, stroke, and dementia. Linear models are useful in early stages. Nonlinear models explain final collapse. Most mortality events occur in the nonlinear phase, where simple intuition fails. Engineering concepts such as fatigue, rupture, and material strength are directly relevant. Blood vessels stiffen. Organs lose compliance. Failure rarely comes from one event. It comes from accumulated micro damage. The body is not just a biochemical reactor. It is a structure. Integration, not replacement. Physical medicine does not replace biomedicine. It completes it. Physiology explains function. Pathology explains injury. Biochemistry explains mechanism. Mathematics explains trajectory. Physics explains structural consequence. Together, they form a more complete picture. Surgery already demonstrates this integration. Surgeons combine theory with hands-on reality. Internal medicine can benefit in the same way. This approach strengthens clinical judgment. It improves long-term decision-making. It helps explain why patients with similar diagnoses experience very different outcomes. Preparing better physicians. With this additional training branch in physical medicine, physicians no longer see disease as simply normal versus abnormal. They see direction and momentum. And they recognize early warning signs long before thresholds are crossed out in research. Outliers are no longer ignored. They are studied. Causality replaces correlation. Most importantly, physicians can explain disease clearly to patients, not just what a number is today, but where it is heading, how fast it is progressing, and why. Conclusion: being busy has never been a scientific excuse. Progress does not wait for convenience. Mathematics and physics enter medicine not when schedules allow, but when reality demands it. History shows this clearly. Semmelweis, McClintock, Marshall, and Warren were all right before they were accepted. My 17-year medical journey is itself a case study. I do not claim final answers. I identify what is missing and why it matters. Medicine exists to serve humanity. That principle, taught to me by my father, remains my guide. Epilogue: I could only write this paper now, at age 79, after 17 years of learning, research, and survival. Earlier would have been premature, later might have been too late. This work is not a theory. It is a synthesis of observation, experience, and responsibility. If it helps future physicians see disease more clearly in time, structure, and progression, then it has done its job. Disclaimer: I write this paper not for fame, but to share what I have learned so others can understand their health, prevent disease, and live longer, healthier lives. This content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered or republished as your own. All intellectual property rights belong to the author, Gerald C. HSU. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C.